Hi, Dr. Sasha here from Koji Australia, and today in part 5D of our Moving Your Career to Australia podcasts, we are going to be chatting about the AMC 2. Hi everyone, so today we have a very special guest again here with us, having a chat about AMC 2. We have my friend and colleague Brendan with us. Brendan, nice for you to be here.
Hi, Sash. Thanks again for having me here. I really appreciate it. It's a humbling experience again to be called back.
Thank you so much for taking the time to come and chat to us.
It's always a pleasure.
And to tell the listeners a little bit about AMC 2, considering the fact that Caroline and I both haven't done AMC 2, we actually both did the work-based assessment pathway. So your views and opinions on AMC 2, I think, would be really helpful for people to have a listen to. I'm just going to ask you a few questions that we've been receiving on social media, and you can answer them just as truthfully as you like. And then we'll see where it goes, and we'll see if you can maybe give the listeners a bit more guidance as to whether the AMC 2 might be for them.
Perfect.
All right. It's important to note that these are probably just Brendan's opinions, but we can see where it takes us. So we'll start off just with, why did you choose to do the AMC 2? Did you know that WBA was an option?
So it was still back in South Africa when I was exploring options of coming to South Africa, to Australia, and looking at the pathways on the AMC website and also on the APRA website. I did see that there was a examination and also a WBA, and then I had to then explore, all right, what was entailing to actually do the exam versus a WBA. And what really played a big part was firstly the availability of an AMC exam or a clinical exam versus the availability of getting into a WBA program.
And this is so true as well. Like, we've stressed the point multiple times to most of the people that have asked us questions about the WBA, that it actually isn't, you don't have the luxury of saying, I'll do the WBA or I'll do part 2. It's more like if you get the opportunity to get a job in a hospital that actually offers a WBA, that you actually can go down that pathway. It's not really a either or type situation, and most people will find themselves in the position where they would have to do the AMC 2.
Correct. So I had a job offer from a Australian hospital in a regional area, and that hospital did not have a WBA program. I was happy with that at that point. I did say, fine, I'm happy to write an exam. I just felt fine. It would be okay. I just have to prepare for it. And so it just fell into it that I was then going to be streaming myself into a clinical exam. So yes, availability was the one factor. Second factor was cost or financial. I had to then also weigh up, did I actually have enough capital to actually spend on a WBA program versus then an AMC exam.
Currently, the WBA program is about 3 times the price. So it is a huge consideration.
I was actually looking back on how much I actually paid for the AMC 2 exam. So I paid for it last year, June, and it was $3,265 Australian dollars
and
for that exam.
WBA that I paid for was about $9,000 Australian.
Yeah.
So huge.
Very big difference
to fork out that amount of money in one go as well.
It is.
Which is what they want. Yeah.
It is. So, yes. I mean, I think, weighing up the options of AMC 2 exam versus a WBA, it's a very personalized decision, and you need to weigh up both pros and cons.
Okay. And then did you know the reputation of the AMC 2? It's obviously renowned for its reputation of having such a high failure rate. And that's what puts a lot of people off. It's certainly what put me off. Did you know?
I'll be honest with you. All I knew that was an exam.
You didn't know that you could fail so easily?
Not at that point in time.
So you booked your exam not knowing that the failure rate's like 30%.
So my intention was to write the exam. And when I then went to the regional hospital in Australia, I got there, and then people asked me, well, how am I going to be getting my general registration? And I said, well, I'm going to be writing the exam. It was met with a lot of wide-eyed people.
No one said anything.
And also a bit of gasping. And they did say, well, have you written it before? And I said, no. And they said, do you know that people fail the exam? And I said, tell me more. So, yes, I didn't know that it had a high failure rate or that it was perceived as being difficult. before coming to Australia. I'll be honest with you, I never had a lot of networking done in South Africa to decide, what is it all about, what I should do about it. I just went to the hospital, started working there, and I started then to talk to people and gain an insight into it.
And I think why they were gasping at what you were saying is that I think it's very, very common for people to do this exam more than once.
It is.
So sometimes when people are considering the cost, and certainly what we were thinking as well, because we did know the reputation of having such a high failure rate, that often people would do it 2 or 3 times, in which case it would cost the same as doing a WBA anyway, because you do have to pay the full fee again and again.
Of course, and I did meet people that actually wrote it twice or failed twice, and then they either went on, to other means, another WBA program, or try and write it a third time. So, I had the fortunate opportunity to meet people that have gone through this process.
Yeah, and fortunately for Brendan, he passed first time, which is really huge accomplishment. So we're really proud of him.
Thank you. It was a humbling experience. I must say I did have a lot of help from a lot of work colleagues that I was working with, and I wouldn't have been able to have done it without them.
Yeah. So tell us a little bit about the structure of the assessment. How were you assessed? I believe it's station-based.
Yes. Yep. So with the advent of COVID, the AMC exam had to stop for a while, and then they had to then try and then reincorporate it, because they were having about maybe every month they were having a clinical exam, and it was all in person before COVID. Then they had to then put it as an online or computer-based examination, and I think for the first year, I think in 2021, it was purely computer-based. And then they did realize that they needed to also then accommodate for people who weren't comfortable with it, or to try and find a means to accommodate people who were willing to travel to Melbourne. And so then it was a combination of both online or an in-person. And you could choose when you actually applied online. So for me, at that point in time, with me being very far away from Melbourne, I felt the most appropriate way would just be an online exam. So I didn't have to then pay for traveling costs, put in, time for leave, and then to go down. And also with COVID at that point in time, flights and states were flights were being cancelled. States were closing off borders. So I just thought, let me just nullify all of that, go with an online exam. So
brave.
Thank you. So the online exam and also the in-person exam has the same concepts of how they evaluate the doctor. There's a total of 20 stations. 4 of them are rest stations, and then there's another 16 stations in which it's either a history-taking station, a clinical exam station, or perhaps maybe discussion of management or counseling stations. And of those 16 stations, 2 of them are actually test stations for future examinations. So they don't really count toward your score. If you pass them, all good and well. If you fail them, all good and well. It just doesn't count. You are then actually left with 14 stations that you're assessed with, and in order to pass, you have to pass 10 of those stations.
And then you said it was online? Was
Yes.
it over Zoom, or how did you do that?
So what happens is that you have to be downloading a protected browser, which is issued by the AMC itself, and that browser then allows you to run Zoom. So you have to have Zoom installed onto your computer. And they give you also certain types of regulations on what size computer it needs to be. I think at that point in time, you couldn't run a Mac or an Apple.
No. Cutting out 50% of users.
Yes. For some. So I think it might have changed, but yet at that point in time, you had to actually, you couldn't use an Apple Mac, and you had to have a screen size of at least, I think, maybe 13 inches or 15 inches. And then at least then your processor was fast enough to actually then run the protected browser and Zoom.
How's your computer skills?
It's okay. For the examination wise, you don't need skills to type. You just need to know on how to be presenting yourself in front of the computer.
Yep, and obviously, have a reasonable quality camera.
Yes.
And set up your laptop in the way that,
Yes, so your laptop had to have a webcam.
Mm-hmm.
I could be mistaken, but I don't know if you're allowed to actually have a separate webcam put on. It had to be built in with your computer, but I stand to be corrected. You also had to have a mouse, actually 2 mouses. In case one messed up, you had a spare to actually still then use as well.
Okay. Did you go out and buy an extra mouse?
Yes, I did.
Yeah. Okay.
Yeah.
All right.
So just to prevent any problems that could actually occur whilst you are doing an online exam, and again, also you have to have a very good internet connection. With that protected web browser, they actually then put you through a process to test your upload speed and your download speed to actually see that it is viable for that examination to run.
Sounds pretty well organized.
It is. It is. I must say, it was well organized. And there was glitches. I even had glitches myself or so. But yet, I think after 1 or 2 or 3 trial runs of the online exams, they were trying to polish it out. But I think it was a job well done. Well, for me, the only issues that I had is I had a hailstorm.
Oh
so
no! Sound
that cut my reception out. And then I think it was a general group where the whole system went down for a couple of months or so. But they got you back online. They gave you and sorted it out, obviously. Okay. And you still progressed as is. So there was no problem or interference on the time that you actually had with the patients.
Good. I know the next one is pretty much a loaded question, but I suppose in summary, how did you prepare for the AMC2? I'm sure there's lots of people out there that are trying to prepare. And
so
there are courses available. Yeah?
Yes, there's a lot of things available, and so I did a lot of talking to people, trying to fathom out what they've done. I can give you a lowdown of what other people have done and essentially what I did. I got a few notes from one of our work colleagues that I went through, and then I felt, okay, I do really maybe need to do some type of course. Even though medicine is medicine from a biological perspective, you need to understand that systems are different and expectations are different.
Yeah, the Australian context.
Yes.
Yeah.
And also, a child who's failing to thrive in South Africa have very different diagnoses or differentials versus a child failing to thrive in Australia.
Definitely.
I mean, a child failing to thrive in South Africa would be malnutrition, HIV, perhaps TB. In Australia, it's galactosemia, celiac disease, and perhaps maybe domestic issues.
Yeah, literally worlds apart.
It's worlds apart. And you just actually have to put your mind in a different perspective when you do trying to think of differentials. So I did go through a course. So there's a few courses that are out there. I know.
And I think they're quite highly recommended for the Part 2 exam. I know Caroline and I, when we did our talk on AMC 1, we did say, if you didn't do a course for AMC 1, it would probably be okay if you could study. But I think for AMC 2, it seems that most people that are successful are the people that are doing the courses. So I think it probably is necessary.
And I do see the value in that. It does teach you, the way of thinking in which the AMC exam is looking for. It does also teach you what differentials, what you need to look for. And also it does teach you on how to structure yourself, on when you are actually approaching the patient, and also how you present yourself to the examiners. So the course that I did was it was an online course that was offered by a doctor in a regional hospital in central Queensland. She did have ties to the Melbourne-based system before, and so she offered 2 things. It was either you paid a subscription to her website and you watched all her videos at a baseline price for 3 months or 6 months, or you could do online live classes with her. But then that was then at a premium, and also you had to have scheduled times. Unfortunately, I was working full-time currently with the regional hospital, so I never had the luxury to then take off 8 weeks and venture down to Melbourne or do the live courses with her. So I just paid a subscription to her website for 6 months, and I literally in my spare time just sat down and listened to her videos.
Yeah, and it's nice that she had that option as well.
Yes,
for busy people or say people studying from other countries with time differences and things. So I think that's a really good alternative.
And I must say, I commend her that she did a good job.
Yeah. Well, you passed. So her course clearly does do something.
Thank you. So yes, I think these courses are valid. It teaches you a lot of nuanced things that the Australian system wants. And I think also you just need to be reading a certain text and to become familiar with the clinical examination which Australian systems aspire to. So that would be your Tally O'Connor clinical examination. I know in South Africa, some guys were doing Hutchison or something else, and some other guys were doing Tally O'Connor. I was fortunately, my undergrad was with Tally O'Connor.
Ours as well.
So that was in a benefit because it is an Australian text.
And I didn't know that. I didn't know Tally O'Connor was an Australian textbook. It's a wonderful textbook. I still refer to it every day.
No, it's good.
It is a really good foundation for any learning. So
and
it's a good place to start, I suppose.
Yeah,
for
very
AMC2.
true. Very true. And a lot of the doctors were saying, okay, you can do those courses. If you wanted another text to be reading, they would have then used it in AMC1, which was the Murtaugh's general practice.
Yes.
So, those were basically the two things that were resonating through a lot of people, and to try and do a course. So I managed just to do that course, and it was good. It suited my time frames and also my limitations that I had.
Okay. And then you mentioned that you were working at the time of studying and preparing for the assessment. Do you think actually working in an Australian context benefited you in preparation for your exam and gave you sort of a different way of looking at things?
Absolutely.
Yeah.
I think, if I had to have prepared for it back at home, I would still be in a mindset, in a South African context.
Yes.
And also what helped me is that I went to go work in the emergency department of this regional hospital. So it gave me exposure again to pediatrics, to obstetrics and gynecology.
Of everything.
So what I actually did is that when I started to see patients after I've started practicing or studying for the AMC2, I would actually practice the approaches with the patients. And what it actually did, it actually made me a lot more efficient in, time-wise with the ED patients, and also how I would refer to the patient, refer to the doctors.
You helped your actual practice as well as helping you study.
Yes,
Okay.
Especially also with the psychiatric patients. I would go through a certain technique which was taught or so. I mean, it's a mnemonic. And, if you had to then use that mnemonic and present it to the acute care team or the psychiatrist, even with the pediatricians, I would say there's the danger questions were asked.
Yeah, sick child questions.
Sick child questions.
Yeah.
Bins is all covered. They know exactly what you're talking about. So I think, Australia has been schooled in a nuanced way. And if you have then practiced in the system a bit, you start to learn the lingo.
Yes.
There's a good saying in business culture whereby if you want to go global, you have to go local. And it's so true, even if you're wanting to now learn on how to practice in a new system.
And I suppose if you're referring a patient to a registrar or a certain specialty and you are using their lingo, they automatically think that you know what you're doing.
Yes. Yeah. So yes, I would really recommend that to actually get into the system, work in the system for a while, if you have the opportunity or the privilege to do that. And that really helped me with the AMC2 exam, I have no doubt. And
that's, I think, why we encourage people a lot to, after they've got their AMC1, with the only limited registration, you can work with limited registration.
Yes.
You don't have to wait for AMC2 to actually start applying for a job. And in fact, you actually quite hireable even just with AMC1.
Yeah.
Another thing I wanted to ask, with WBA, I felt that what I loved about it, it has a lot of benefits, but one of the things that I did love about it was that with the assessment, it felt quite authentic because we would get taken to the patient's bedside and we were tested on very similar aspects. When we had a look, Brendan, at the assessment sheets, and you mentioned, that it was very similar to the AMC Part 2 very assessment sheets. But the difference would be is that we would have the examiner and that he would take us to a patient that was usually in the hospital that we were at. Not only were you sort of used to that examiner because they are doctors that you potentially would have worked with before, so you have that edge. It's also in a hospital that you'd be examining the patient just as you would every single other day, so it felt very authentic. Just wanted to know, in terms of you dealing with the patients, I'm assuming it was not real patients that you were being tested on.
It was simulated patients.
Yeah.
So
okay.
They were actors, and they've been schooled on what to say, how to present or so.
But did it feel I know it couldn't feel as authentic, but did you at least feel comfortable, or was it just a very pressurized, clearly an exam situation where it was all very, put on?
I think this would then go back to, on how know your strengths and your weaknesses and your limitations. For me, fortunately, I've been able to be comfortable in speaking and in presenting or presenting yourself. And so when I was in front of a computer, I know I was talking to someone over a screen, so it was in live time, it was to a real person, but it just didn't have that, that authenticity of standing next to someone, being at the bedside.
Yep.
Although, if people have done the AMC2 clinical exam in person, it would then probably feel like a full-on clinical exam, and that familiarity that they've gone through before is there.
Yep.
So that might have been a bit of a difference. But for me, I just realized, fine, this is what it is. I just have to perform as if I was actually doing a clinical exam, because that's what I know what I do.
Yeah, just get your head right.
Get your head right. It's a psychological aspect.
It really is.
And so you have to know yourself.
Yeah.
Really, you do.
Okay. And did you think that the assessments were at the level of a final year student? That's what they always say, hey, that this is, these assessments are all to the level of a final year grad in Australia, and at the level that all interns would be assumed to be at.
Yes.
Do you feel that was fair?
Yes, I think so. Because, working with interns and also medical students in an Australian system, you could quickly gauge the level at which they are at, and their skill set, and how they think, and their knowledge. So when I was then being assessed, I had to also consciously remind myself that I needed to take myself back to being an intern or a final year medical student, and stick with the basics, because that's what they want. They wanted to see that you are able to know the basics at the level of the final year medical student, and so
be safe.
And be safe. That's all.
I think the problem with having a bit of experience when you come into these things is like, coming right back down to the fundamentals again.
Yes.
When you're so used to sort of doing a lot of the steps automatically in your head without actually saying them out loud.
Yeah.
And getting to the end point.
Yeah, very
kind
true.
of like in school when you do maths and you have to show you're working.
Definitely.
Exactly the same.
I think it's also, some people might see it as a invasion on their ego, on their ability, or their, competence as a doctor, especially when you've practiced for so many years. Now, when you're then being asked basics again, some people may feel it uncomfortable. Some people may feel or taken aback that it's an insult. But you just have to realize that it is what it is, and you have to just ride with the wave.
And in defense of sort of, the Australian healthcare system, getting immigrant doctors from all over the world, it must be very difficult to standardize, the level of the care that's going to come into their country. And I understand why they have to have these procedures and things like it. It is terrible. Even if you have a bit of experience, like it's horrible to have to feel like you're doing all these tests all over again, or being assessed all over again when you feel like you are already good enough. But I totally get where they're coming from.
Definitely.
I feel like it's necessary that they have these.
And I met doctors who were really good doctors, from other parts of the world, even South African doctors, and they struggled to pass the exam. I know a couple that failed twice. I know another doctor who came to Australia years ago, but he actually took 5 years to actually pass the AMC2 exam.
I suppose this probably follows on for our next question. Why do you think that people are failing at this rate? Why do you think the failure rate is so high? What is the sore point here? Because like you said, there's good doctors that you've worked with.
Yes.
There's been doctors from countries that are English speaking that are failing. Because I know a lot of people, there was a lot of thought that perhaps a language had a lot to do with it, and getting your point across if you weren't good at English, that maybe things were getting lost in translation. But why do you think that people are failing at this rate?
I think my opinion is going to come through then all the people that I've encountered where they failed, and I've tried to then assess then why.
What is the difference between them and you?
Yes, also. So, I had a couple from South Africa. They failed twice, and they were very good clinicians. So why and their English was good. So the question is then, why were they failing? And I never really went into depth, after they've wrote the exams, why or so. But one thing firstly is that, are you delivering what they want? And that's basics. You perhaps don't want to be overstepping that boundary from there. Not saying that this is the reason why they did fail, but, it could be a possibility. I stand to be corrected, but I think the first thing is that you need to deliver what they want and know what they want.
You've kind of got to put everything that you know aside and learn to deliver not what you know to be true or right, but you need to deliver what you think that they would want to hear.
Yes, and the basics at a final year medical student.
In Australian context. Yeah.
So I think that would be one reason why people fail. Second, definitely communication.
Yeah.
I think, how you present yourself, how you sell yourself, how confident you come across. They would also appreciate that, because if you are confident in your sayings, in your management, or in your differentials, whatever, that would also then show the patient that they can trust you. And I think there's an underlying component where the AMC, they also would ask then the simulated patient, what do you think of that doctor who has just seen you? And they might also have an input into the final examination. I could be wrong, but...
It's interesting that you say that as well, though, because one of the things that I've noticed, and I've told everyone that I've noticed since I've been working here, is that even very inexperienced doctors here that are local graduates or Australian doctors that are very young or have just qualified, I'm taken aback by how well they can carry themselves and the confidence at which they carry themselves. Even if their medical knowledge is, lacking or the experience isn't there, they still are able to come forward as sort of a professional person, which is something that I don't think that we learned as doctors until certainly for myself, maybe 3 years post-grad was probably where I was carrying myself at the level that the interns are carrying themselves here right out of university. So it's interesting that you say that that's probably, I would agree, because it seems that that's kind of the professionalism that they're trying to create.
I think so. There is an expectation from being a medical professional that you should carry some dignity and some pride and some confidence, and you have to allow that to percolate when you are actually, presenting yourself or even asking the questions to the patient, the simulated patient. So communication is the one aspect. Then we could even divulge into English. We have a lot of, listeners that come from countries that aren't first English speaking. And I've actually been quite humbled to see some of the doctors who have come through that have learnt English and have passed the AMC exam. We have a few South American doctors that could not speak English and they learnt English.
I chatted about this in my barriers talk as well, that I've just got the biggest respect.
Yes,
there are people that I've met that are practicing medicine just alongside me that have only learned English 3 years back. It's like me saying, in 3 years from now, I'll be practicing the whole of medicine in Spanish.
Exactly.
It's impossible.
It's really enlightening and inspiring to see that. And
inspiring.
For me, I can speak English and a little bit of Afrikaans, like a little bit. And I spent 12 years studying Afrikaans. And I can't speak anything else, unfortunately. So again, back to the English. Do you have to speak English very, very well to pass the exam? I'll give you another example. Again, a work colleague, she's Vietnamese. And she even said herself, Brent, I don't speak English very well. I know that. And she failed the first time round. She actually got passed 9 out of 9 stations. So she just missed it by 1 station. And we had a chat. We tried to troubleshoot, where she could improve or so. And she then wrote the exam 6 months later. And her English didn't improve in 6 months, but she passed the exam. So a Vietnamese doctor who doesn't speak English as a first language managed to pass it on the second time, whereas then you have doctors coming from countries where they speak English as their first language, not being able to pass it on their second time.
So I feel like although language might probably play a part, it's more how you communicate your points.
It's how you communicate your point and giving them what they want, which is the basics. And I think that's what played in her, as her strength, second time round. And she actually said, Brent, I don't know how to speak English well, you know that, but yet I managed to pass. And in her second time, I think she got 12 out of 14 stations.
Oh, excellent.
So she did reasonably well. So...
Yeah, so I suppose the next question I'd have is, if you had failed, would you have paid again and done it again? Or would you have sort of gunned for a WBA?
So, yes, so that did go through my mind. I
Mm.
mean, when I finished the exam, I said, okay, it was a fair exam, I have to admit. What is the worst case scenario? I could have could have failed. So I needed to then make contingency plans. And so what I was then looking for is that, fine, I perhaps maybe need to then go to a hospital in which would then offer a WBA program, so that in future, where it be a year or two, I could fall back on that.
You could have that option.
I could have that option, but yet I would still give the AMC2 exam another try.
Okay.
I did say, fine, if I do fail, I'll apply for it again, and then give it a go second time around. And the reasons being is that I know the process. I've worked already towards it. And thirdly as well, then from a cost perspective.
Yeah.
WBA is 9,000. AMC 2 is 3,500.
Right, Brendan, to end off, what advice would you give other IMGs that are studying for the Part 2 AMC?
Good question. I think there's going to be a lot of factors that you have to consider. Firstly, I think you need to know your strengths as a person and as a doctor, how well you communicate, and what you can do to improve those communication skills. Work on your English, fine-tune it. Like I said, there's been people that can speak it, they can't really so well. Some pass, some fail, but at the end of the day, you also have to look towards the future, whereby you're going to be working in an English-based system for many years, so there's no harm in fine-tuning your English. And lastly is the part about knowing what they want and being able to deliver that in a good, concise, and confident manner. And if that means that you have to go through courses, and also, do role-playing with other friends, other colleagues or so, do anything that really helps you. I think that's going to be the most important thing. And also have a contingency plan. If you see yourself maybe not being able to pass first time around, what are you going to do afterwards? Are you going to decide to write it the second time or the third time? Or should you start to look at other means so that you can have that path to general registration? I think those would be the crux of the matter, really.
I think that's really, really helpful advice, and I think it's going to give a lot of listeners insight as to whether this is for them and how they can start preparing for it. I think that's pretty much all the questions I have. Thank you so much for coming on the podcast and taking the time out of your busy schedule to chat about this. It's always nice having you and chatting to you about it.
Thanks, Ash. It's great to be here. Humbling experience, like I said before, and I'm happy to help out where I can. But good luck to everyone else.
Awesome. Well, thanks everyone for listening. If you liked what you hear in this podcast and you like this whole series and you want to hear more about moving your medical career to Australia, find us on social media at CodeU Australia and have a look at our YouTube channel, where we put exclusive videos up and podcasts that are very similar to these ones as well, with more information about AMCs and the standard pathway and how to move your medical career to Australia. Thanks for listening, and we'll see you in the next part of the series.